Okay, the COVID-19 crisis is certainly shining the spotlight on the nursing field. The career holds high interest for minorities, but a low retention rate. Black Girl Blue Scrubs is an organization that advocates for minority nurses to help them enter nursing and advance into leadership roles. Joining me now is Kalia Owens, founder and CEO of Black Girl Blue Scrubs. Welcome, Kalia.
Hi, good morning. Thanks for having us.
Yes, you're so welcome. You have a great program working here. Let's talk first about how you are helping nurses right now during the COVID-19 pandemic.
Oh, absolutely. So nurses right now, if you think about burnout, so the nursing field has a high burnout rate. One study even showed 86% of nurses experience burnout. So we give them some tools to help build resiliency during this time. We have a podcast called Through the Nursing Lens, and it has a lot of inspiring stories for nurses so that they can help navigate their career, navigate crises like this. We also send out a weekly newsletter where we give them some motivational tips, ways to deal with self-care, things that are going on their units. And then we have a GroupMe app, which is really cool. We have healthcare professionals in the DFW area, and they've really been plugged in right now to, get resources for jobs, accurate information, and ways to pivot.
Nice.
I'm sorry, go ahead.
Oh, my apologies. You can carry on there.
Had a Zoom conference to celebrate healthcare heroes, and that one was really, really important to looking at the CARES Act and how that can help our nurses.
Okay, well, now more than ever, Kalia, I feel like your organization is taking on a new level of responsibility. Why is the work you're doing now more important during a time like this?
Absolutely. We talked about building resiliency right now. And so any frontline worker, whether, healthcare or nursing, they need to build resiliency right now so that we can adapt. Information is changing very, very quickly, coming down the pipelines in regards to COVID-19. And so now more than ever, we want to stay connected. And so we have a community of over 8,000 healthcare professionals, and we really help them stay plugged into resources and to each other so that they can refill their cups, stay inspired, and stay up to date on latest information.
Can you tell me about some of the stories you've heard? What are nurses dealing with out there right now?
Absolutely. So I work as a nursing educator in the hospital, and a lot of nurses, when this first started, felt a lot of anxiety and fear and panic. And so it's very hard to retain information about your safety and what needs to be done in the hospital if you're scared. As we see, nurses are caregivers. And so with COVID-19, when you have so many patients that aren't recovering right away, that can weigh heavy on caregivers who, look forward to that reward of their patients getting better. But over time, we've seen the numbers go up. We've seen patients get better. We've seen nurses, their spirits are definitely being lifted. We have a few nursing students that aren't able to graduate, and they are first generation minority students. But, we're fingers crossed they're able to get graduations in the future. And nurses are tapping into their superpowers, their faith. Why did they become a nurse? And then, self-care.
Okay. Well, how can all of us, how can family members or, really anybody help out during this time?
Oh, absolutely. I would say nurses love food. So just tap into your local hospitals and see if you can send nurses, any type of food or gift cards and things like that. Please support the PPE campaigns. That is a really good source for us. And then protect your vulnerable populations by protecting yourselves. And that's how you can protect us, by practicing safe social distancing. Okay,
real quick, Kalia, can you just tell folks where they can find information?
Absolutely. You can visit us at blackgirlbluescrubs.org or follow us on Instagram at blackgirlbluescrubs.
Okay, thank you so much for joining us. Appreciate the work that you're doing here with this organization.
Thank you.
Okay.